Hello and welcome to another presentation in our series on One Health and Zoonosis under the Belize Wildlife Ambassador Program. Today we're talking about a nightmare of a parasite. It's back 30 years after it had already been eradicated. I put here just another bot fly because that is a common misunderstanding that this is just like the same bot flies that we have known here for decades, which is not the case. And yeah, the last name of the parasite we're talking about today is hominivorax, which translates into man-eating. So not just another bot fly. But I wanted to start by giving a big shout out and thank you to Baha for providing a wealth of materials that I will use in this presentation, as well as their support and funders from the Ministry of Agriculture, OIRSA, USDA, and ICA, who have helped compile educational materials and provided us with training as well. And one of the key messages of this presentation already, if here in Belize you see any suspicious cases, please contact Baha and report this to them. And the contacts and phone number is here and on multiple other slides. So why we talk about One Health, to backtrack a little bit for those who have not seen all of our other presentations, the One Health concept talks about the many connections between the health of humans, animals, and our shared environment. We, as the Wildlife Clinic, talk about this because when we protect one being wildlife, we are with that hoping to help protect all. And what are zoonotic diseases again? Those are diseases that spread between animals and people. And you have heard us talk about this a lot in this program. And if you have not seen them yet, I encourage you to check out the other zoonosis presentations as well. What many do not realize or remember is that when we're talking about infections that humans can get, more than half of those infections are zoonotic, so shared between us and animals, giving this a huge importance to human health. But now to talk about New World screwworm fly infestations. We will talk about what is this, how common is it, what does it look like in animals and humans, how do we get it, how do we know we have it and diagnose it, and then most importantly, how can we avoid getting this, what's the prevention, and a bit on treatment. So what causes this disease is a fly called Cochleomia hominivorax, or New World screwworm fly, and it causes myiasis. The look of the fly is about 8 to 10 millimeters, metallic blue-green with reddish-orange eyes, as you can see there. The larvae do look like just a botfly, creamy white with series of spines on them, and the eggs do look like other fly eggs as well. So we have to talk a little bit about the life cycle, starting with the adult fly. Takes about 6 days, and they will lay around about 300 eggs per fly that will hatch within only 10 to 20 hours and turn into these larvae, which will then develop really quick. Again, unlike all the other bot flies, they develop in only 5 to 7 days in the wound, and then they will pupate. And 7 to 10 days later, we have potentially 300 more adult flies who each can lay 300 and more eggs. So highlight here on the very fast development, which already hints towards prevention, is we have to very frequently check our animals every day because this parasite develops very fast into very severe infestations. So yeah, the eggs are laid on edges of wounds and they hatch within a half a day to a day. Here you see this image of the larvae, and they burrow deep into the wounds, and it looks a bit like a corkscrew, which gave them their name. However, unlike botflies that do not cause much damage, these will cause extensive damage and eat down into the flesh or whatever tissue is below where they infested. So here is a picture of the larva. And now to the prevalence in Belize at this point. We have had cases in domestic animals, wildlife, and humans already. The first case in domestic animals was reported on December 28th last year, and that was in cattle in Toledo. The first case in wildlife was reported then in July 29th this year in a howler monkey here in the Cayo district. And then shortly thereafter, the first human case was reported on August 18th. The total number of reported cases as of September 8th, was 527. And in this graph here, you can see some of those numbers. So elsewhere, the most commonly affected species by this fly is cattle. However, here in Belize, most commonly now, we see it in dogs. You can see this here. Canines, 268 cases so far, and cattle is 121 cases. We can go down here, so 60 cases in pigs, 36 in horses, 26 in sheep, 5 in goats, and then 3 in monkeys, 3 in cats, and 2 human cases by now. All warm-blooded live animals can serve as a host. This is what has been reported so far. And the question has sometimes come up if an animal dies, which can happen as a consequence of this severe infestation, the fly will not continue to develop. The numbers are increasing, hence us now compiling a separate presentation. Despite there being a lot of material already, we wanted to put it together in this format for you as well. So to the disease in animals, at first, the eggs may be barely visible. The larvae hatch very quick and then start aggressively eating into the tissue, causing severe wounds that very often get infected and smell very bad. Without treatment in severe infestations, this can lead to death. Now to the picture here of our first human case in Belize. Similarly, the first symptoms of infestation will appear quickly as soon as the larvae hatch. And yes, so the wounds are often associated with bad smell. Sometimes the larvae may not be as visible deep in the wound, but the smell may give this away from afar. And secondary infections with bacteria on top of it, making this a lot worse, are very, very common. So how do we get this? Through having any wounds. The fly will lay the eggs next to or into wounds. That wound can be as small as a tick bite, so barely visible. Any surgical incisions can also serve as an invitation to this fly, which can unfortunately also enter nose, ears, or mouth, and then get into the body through those orifices and cause, again, severe infections and including death. And sadly, for humans, it is especially compromised and handicapped persons that are at high risk. For example, persons that are not verbal or don't have access to medical care. Excuse me. How do we know we have it? So how is it diagnosed? I have to repeat, this is a reportable disease in animals, so it needs to be reported to and confirmed by BAHA. I added in here our Ministry of Health because in case you actually are unfortunate enough to see this happening in a human, then it's the hospital and Ministry of Health that will help you. How do we recognize it? You could say it's fairly simple by the clinical symptoms. So larvae in a wound. using this excellent flyer here, you can see the listed signs in pets there. So maggots in open wounds. You could see swelling, redness, and foul-smelling discharge on the wound. You could also not see any maggots, but see excessive licking of a wound. And then as infections settle in, you may see loss of appetite, weakness of the animal. So learning about prevention measures is crucially important. And for general control, you want to keep your pets healthy and on regular preventatives, which in many cases will also include coverage for New World Screwworm fly larvae. This very much depends on species, age, and breed, what you can use. You want to prevent any wounds. If there are wounds, you need to clean and treat them daily. Talk more to your veterinarian. And again, repeating from the BAHA handout here, monitor daily and treat any wounds clean daily. And any infestations you notice, report them immediately. The New World Screwworm can spread very fast, so your awareness and quick action will make all the difference. Because as mentioned, any larvae that is not removed and killed will turn into a fly that can lay 300 and more eggs, aka flies, and more worse infestations with this pest. So some more tips on prevention. Again, check pets daily for any wounds, keep any injuries clean and covered, use approved fly repellents, and ensure and monitor daily if there are any surgical incisions on your animal, and report suspicious wounds immediately. So how it can affect is, as mentioned, through open wounds, even tiny ones, surgical incisions. Umbilical cords in newborns are also a route that this fly can take, so those need to be treated and checked daily, as well as body openings. Remember, the larvae hatch within 12 to 20 hours and begin eating tissue and causing destruction very quick. So always watch for wounds, foul-smelling discharge, visible maggots, reluctance to eat or move in these animals, or excessive licking and swelling. So if you do suspect screwworm, isolate that pet, prevent any fly contact with a wound. Do not treat it yourself, but contact your veterinarian and report to the animal health authorities, aka BAHA. So it is a notifiable disease. The notification is crucially important so that this pest can be eliminated again. The next material by BAHA. If we want to control the spread of New World Screwworm, we must treat and cure all wounds. You have to ensure, with the help of your veterinarian, that all larvae are removed from wounds and destroyed, because otherwise every larvae, aka worm, will be a new fly, laying hundreds of new eggs. Specific to livestock, you want to treat the navel of newborn animals until it heals. You can use preventative treatments with 1% ivermectin before procedures like dehorning, ear tagging, and castrations, where you know there will be incisions that will be invitations to this fly. And yes, in case of cases, all or of a confirmed case, all larvae need to be removed and approved larvicides applied. And yes, do not try to cure with home remedies. I have to say, I see a lot of chatter on social media with toxic products that are suggested to be put on this to kill the larvae. And we do not recommend you follow any of those because many of those treatments could be deadly to your animal. They may kill the screwworm, but they will also kill your animal. So again, call Baja and your veterinarian for more information. And together we can eradicate it. It will not be easy, but the first most important step that everybody can take is strengthening good husbandry practices to keep giving this fly any opportunity for wounds. So repeat one more time, check your animals daily for wounds or worms. Also, eliminate any potential obstacles, meaning if there is sharp corners anywhere where your animal could get hurt and then have a wound, that would be an invitation. If you can, please eliminate those. Um, Specific to livestock, do not transport any injured or illegal animals, and consult your trusted veterinarian. So elimination really needs your support in being aware, detecting, reacting very fast, and immediately reporting so that you can get treatment and for this case, so it stops spreading from there. I just wanted to put these prevention medications here. So prevention is absolutely key in all species. We have not talked about prevention in wildlife, which of course is a different topic and not so possible, but any species that are in human hands. For specifically small animals, there is currently no FDA-approved drug for New World Screwworm prevention, but there are many medications that have coverage for New World Screwworm larvae that are also included in monthly preventatives. So specifically, ivermectin, well known, nitinpyram, which is the ingredient of Capstar, also helps to kill and has the least side effects if you have, for example, cases in puppies. And then there is the whole group of Sarolana, Lotilana, Fluorolana, which, for example, NexGard as a chewable preventative for dogs contains, and then milbemycin, which is in NexGard Spectra, for example, that will kill New World Screwworm and seem to also have the same preventative action, even though none of them are FDA labeled yet. This may be in part because this worm was eliminated for 30 years, and this will hopefully change. So again, repeat, prevention is key. Always take your pet to the vet. Keeping your pet healthy, getting back to the motto of this whole line of presentations, keeping your pet healthy will help keeping you healthy. You may have seen from the numbers of New World Screwworm, they are truly large in the domestic animals. We have now had 3 cases in wildlife and 2 cases in humans. So if we protect our domestic animals from this parasite, we will also be protecting our humans. So keeping our animals healthy ultimately helps us humans in many which ways. A big thank you to BWRC's funders for the Belize Wildlife Ambassador Program since November 2024, the United Nations Industrial Development Organization and the Global Environment Facility. Thank you so much for your attention, and feel free to contact us with any questions.